7-year-old Utkarsh has been in this New Delhi hospital for almost 2 weeks. He's got dengue fever, a mosquito-borne disease that can be fatal. He's getting better, but his mother is angry he was infected in the first place.
Government is not taking any action regarding this, that patients should be reduced, but they are increasing year by year. There are no beds in the hospitals, and patients and the family of the patient is also sufferer.
Despite a public health campaign urging people to take preventative measures, more than 3,000 people in the capital have been affected this year, and at least 5 have died. The authorities have stepped up efforts to combat its spread by spraying insecticide in residential neighbourhoods. Dengue fever hits India each year at the end of the monsoon, when moderate temperatures and high humidity combine to provide the ideal breeding environment for mosquitoes. This year's outbreak has been particularly severe, and hospitals are overwhelmed with patients, showing classic symptoms of high fever, headaches and joint pain.
We are getting news from big public hospitals that they are shutting down their surgical wards, shutting down their elective surgical procedures to get the increased load. So I'm sure from the bigger public hospitals to the big private hospitals to small-time nursing homes, all of them presently are fully occupied, running to the brim, and probably they are now doing their surge management to accommodate extra people, patients.
Meanwhile, some doctors believe official figures represent just a fraction of the problem. The Delhi government only registers cases after a positive result from one of the 2 standard dengue blood tests. But the antibodies only show up in tests several days after infection. But by that stage, around 80% of patients are already recovering at home.
When the infection load is low or the fever is low, patient recovers himself, then they don't go to hospital and get admitted. So that figure is also not counted. So that is why I believe that the number of cases in Delhi is quite a multiple of the total that has been given by the government to us.
In India, cases have increased sharply over the last 5 years, with 38,000 so far in 2013. The authorities say they've added beds to hospitals to help them cope. Meanwhile, many of Delhi's residents are waiting for the outbreak to wane when temperatures drop in a few weeks' time. But they know the mosquito menace will be back again next year.